Hello everyone, my name is Lira, I'm from Brazil, and I'm presenting to you our study called Using the Continence App Can Improve the Knowledge of Puerperal Women About Urinary Incontinence, a randomized controlled trial. We are from the Federal University of Ceará in Brazil, and my attendance here today was funded by this very own institution. As we know, urinary incontinence is a common health issue among women, and pregnancy and childbirth are some of the risk factors related to this condition. We also know the effects of UI after childbirth seem to persist in their lifespan, even after the recovery. So, thinking about the effects of UI after childbirth, we created a mobile app called Continence App that provides women information about the urinary symptoms and also a training exercise program to help prevent this condition. So our hypothesis is that users of the Continence app will present an adequate knowledge rate on urinary incontinence higher than that of women in the control group. Therefore, we aim to evaluate the effectiveness of using the Continence app to increase rates of adequate knowledge about urinary incontinence. We performed a two-arm unblinded parallel randomized control trial with 102 women that had vaginal delivery at term in a maternity hospital. We used the Consort eHealth as a methodological reference. We included women in the postpartum with a smartphone compatible with the application, and we excluded those women who gave birth to infants who were small for gestational age, those who did not know how to read, and those who referred UI prior to the last pregnancy. We discontinued those women who we were not able to reach a telephone contact after 3 attempts to assess knowledge. We performed a preliminary data analysis with 63.2% of data that was collected from an ongoing clinical trial, which has 136 women as its final goal. After signing the consent form, the women were randomized according to a list previously prepared with the help of the website randomization.com, and the intervention group received in-person access to the Continence app on their smartphones for fully electronic and free use for a minimum of 13 weeks. The control group, however, received routine care from the institution, including a visit by a physical therapist to teach pelvic floor muscle training. The improvement in knowledge was measured from the use of 10 questions related to the knowledge of the KAP-UI scale, which assesses knowledge, attitude, and practice on urinary incontinence. These questions address knowledge about symptoms, risk factors, UI severity, and ways of prevention, and also treatment of urinary incontinence. Each question has a score ranging from 0 to 20, totaling a maximum of 100 points. The higher the score, the greater the woman's knowledge about UI. The secondary outcome was the presence of UI that was measured using the International Consultation on Incontinence Questionnaire short form. We used the Brazilian Portuguese version. And identification and knowledge assessment data on UI were collected in person at baseline and also by phone 3 months later, which is the time required to complete the Continence app training program. Data analysis was performed with the intention of using the t-test for paired samples and Mann-Whitney with 95% confidence intervals. We included 38 women in the intervention group and 48 women in the control group. Most of them were young, with an average age of 26.2 years old, an average of 10 years of study, and monthly income with an average of $289.85 US, and most of them did not have a paid work. They lived with a partner and had an average of 1.8 childbirths, and most of them were vaginal deliveries. Most women in our sample denied having any symptoms of urinary leakage, and we did not observe any differences between the groups in terms of social demographic, gynecological, obstetric, or clinical characteristics at baseline. The initial knowledge assessment was similar between the groups. When it comes to knowledge about UI, we observe that 100% of our intervention group have heard about UI and 97.9% have heard about the symptoms. However, we did have the lowest percentage of correct answers in some aspects related to prevention of UI, risk factors related to UI, treatment, and UI severity. Both groups showed percentages below 50% in 4 questions during the initial assessment. In the outcome, we observed that 33.3% of women in the intervention group and 16.3% of women in the control group reported having symptoms of urinary incontinence, but most of them, however, were in a small or moderate amounts. When it comes to the rates, 31.2% of these women were in the intervention group and 16.4% were in the control group. When comparing the knowledge about urinary incontinence at baseline and at the outcome, we observed that women in the intervention group had increased knowledge after the mobile app, and women in the control group, however, remained unchanged when it comes to the knowledge about UI. We also observed that women in the control group continue to present percentages below 50% in 4 questions about risk factors for UI, prevention, and treatment. Women in the experimental group, however, only presented a percentage of less than 50% in 1 question about the risk factors for UI in the outcome. As a conclusion, we know that the knowledge of women in the intervention group was higher than that of women in the control group, and that our educational intervention mediated by the Continence App proved to be effective as a technology to improve women's knowledge after childbirth on UI in the preliminary analysis. That is all. Thank you very much.